Good afternoon, everyone. Thank you for joining us today for the weekly update, and today's focus will be on COVID-19 and the vaccination efforts in our state. I'm pleased to be joined by Dr. Jose Romero, our Secretary of Health, but also Randy Zook, the CEO of the Arkansas State Chamber of Commerce and Associated Industries, and then Colonel Robert Ator as well has joined us. And I appreciate all of their work during this time. First, let's go to a quick report on the counties. As you know, I set a goal of 50% of the state's population being vaccinated by July 30th. I'm pleased to report that Bradley County has exceeded that goal of 50%. We have a number of other counties that are close to that, but we're still a ways away from a goal at the end of the month. But we congratulate Bradley County for being the first county to reach that 50% goal. And now let's go to the case report for today that shows at the very top that we have 270 new cases in the last 24 hours. Our active cases have gone down some. Our deaths are 6 additional Arkansans have succumbed to COVID-19. If you look at the hospital data, and of course that tells the largest story, that we had a 55 increase in hospitalizations, 55. This is the largest increase in hospitalizations since January. It is the largest increase in hospitalizations since we've had the vaccination available to prevent hospitalizations. And we have 55 added to the hospital rolls as a result of COVID-19. As Dr. Romero points out to me, that the cases are down a little bit, but the obvious reason is, or presumptive reason, is that yesterday was a holiday and this weekend has been a holiday weekend. So we'll stay tuned for the rest of the week, but the hospitalizations obviously tells the story for today. And so today, vaccines are available and ready and accessible by everyone in Arkansas. Vaccines are here and available to prevent COVID-19, but our state vaccination rate is lower than the national rate. And while we have 1 million fully vaccinated in Arkansas, that is not high enough to prevent more cases, more hospitalizations, and more deaths. And so while we were winning this battle in April, when we were down at a very low level in all of those categories of cases, hospitalizations, and deaths, we are losing ground in July. Why is that the case? And let me talk today about the Delta variant, which is now up to 50% of the cases nationally are from the Delta variant. And if you look here, it shows the growth of it in Arkansas. The Delta variant on the left, it was in an early time frame, and that was in May 31st. We had a very small percent of our cases up there. These are the variants that are available. So the blue is the B117 or the UK. You can see the Delta, and then the yellow is the Brazilian variant. And then you have the South African that's red, that has just a little bit is in the third bar graph. But as you can see, just I want to concentrate on the Delta graph though, as in each time frame from May to June 7th, it's the second graph. The third graph is June 14th. The next one is June 21st. The next one is June 28th. And then the last one is July 5th. So you can see the growth of the Delta variant as compared to all the other variants in Arkansas. And of course, the Delta variant is more transmissible and is more virulent than the other variants and the original virus that we saw here in Arkansas. The good news is that the vaccine is effective against all of those variants, including the Delta variant. It has a high level of effectiveness to prevent the actions of the Delta variant, even though it is more transmissible and more risky in terms of health outcomes. And if you go to the next one, I want to make a couple other points about where our hospitalizations are coming from. This graph tells you the average age among those hospitalized due to COVID-19. And this is from November 2020 down through June of 21. And of course, on the left side is November of 20, and then it changes to the right side, which is June 21st. But if you look at the average age back in November, the average age was 63, almost 64. And it continued that way until it started dropping. And of course, it started dropping when the vaccines were out and were being administered in our nursing homes and to our elderly populations. And it gradually decreased where the average age is 10 years lower over here on May 21st. So now the average age is 54 of those that are going into the hospital as a result of COVID-19. You go to the next graph and you see those that have succumbed to COVID-19, the deaths as a result of COVID-19, and you see the same pattern. The average age for death on the left side is 78 years of age, and that declines over on the right side to 66, average age. And so you see hospitalizations and deaths both are hitting at a lower age because the higher age groups are getting vaccinated and they're protected, and we've got a gap there that we need to work through. And so there's two specific additional strategies that I want to talk about today. First, I am asking employers in our state to take a leadership role in encouraging vaccines in the workplace. Now, let me emphasize, the employers were the first ones to push us saying we need the vaccines, we need the vaccines. They've done an incredible job of leading and getting their workplace vaccinated early on during this pandemic. But we need them to come back and to reemphasize the need for vaccines in the workplace. First of all, I'm asking the employers in Arkansas to give paid time off for workers to get vaccinated. Paid time off for workers to get vaccinated. And then secondly, to increase access to the vaccines in the workplace. If we need a clinic there, we'll make that available. If you need greater access and you want to have something at the workplace, we'll work with you to do that. And then there's a lot of hesitancy out there, and so we need the employers to be engaged in informing, educating, and answering questions. This will help us a great deal. We're not mandating anything. We're asking for partners and help through the employer community. And I appreciate the leadership of Randy Zook, our CEO of the State Chamber, and I've asked him to come today to address this issue. Then I want to come back and talk about the second strategy that I wanted to implement. Randy?
Thank you very much, Governor, and I appreciate the opportunity to reiterate some of the points you're making about the importance of paid time off for employees. When you survey employees today about why are you not getting the vaccine or the vaccination if they have not gotten it, one of the top 2 or 3 reasons for being hesitant to take this step is concern about the loss of income due to some kind of a short-term reaction or discomfort that may, in some instances, occur. So many of our employers, especially the largest ones around the state, have taken steps to provide bonuses to employees for getting the shots, as well as assuring them that they'll get full pay for time that comes as a result, time off that results from taking the shots. So we're encouraging all employers, not just the largest ones, but all employers to step back and put some extra effort into this push to get more and more employees vaccinated. And I want to remind people, frankly, I was unaware of this until this morning, but there is a provision in the American Relief Plan that provides for a full 100% tax credit for the cost associated with paid time off for any employer with fewer than 500 employees. And of course, that's a solid 90% or more of our employers in Arkansas. So this This is a new deal. It's very simple to do, a little bit of paperwork, an IRS form readily available on their site to claim 100% of the cost associated with paying employees for any required time off driven by the vaccination process. So we're urging all our employers all across the state to really weigh in on this and provide the leadership that we need from you to get this job done. Thank you, Governor.
Thank you, Randy. The second strategy we want to implement today is taking the vaccine discussion to our communities and in person. And so I'm announcing today that I will begin community COVID conversations. And the first community COVID conversation will be in Cabot this Thursday. Here's the purpose of it. It's a series of statewide community discussions surrounding COVID-19 vaccine, and is to provide opportunities for Arkansans to ask questions, to get answers, and simply to express concerns. We want to hear from Arkansans as to what's happened in your community. There'll be community leaders to listen and answer questions, and the first conversation will be this Thursday at 6 p.m., July 8th, at Cabot, and it will be at the Veterans Park Event Center. So if you're in that area, I hope that you'll join us for that first community COVID conversations. This will continue, and the goal is, of course, to engage our communities at the local level and say, what can we do more to overcome hesitancy, to satisfy the questions of the community, and to encourage vaccinations so that we can increase the rate here in Arkansas to beat the most recent Delta variant that the vaccine can address. And with that, Dr. Romero, I know you've got some additional comments.
Thank you very much, Governor. So quickly to reiterate what the governor stated about hospitalizations, this is the most significant increase we've had, really, when we look at the fact that now we have vaccines to prevent this. And these would have been much worse in an earlier time. So also, the Delta variant itself is extremely transmissible. It is, on average, it is 30 to 50 times more transmissible than the Alpha variant, which is the variant that came after the original strain. So it is very, very transmissible, and that's what makes it spread so quickly among the population. Another thing to keep in mind is that unless you've received the full immunizing doses, so if you're getting Moderna or you're getting Pfizer vaccines, that's 2 doses of vaccine. If you don't have the full immunization panel, you're only 30% protected instead of the higher rates. All of the vaccines to date have been shown protective against severe disease, that's disease that causes death, and the majority of cases of hospitalizations. Lastly, let me close by saying the following. The Delta variant is penetrating into our childhood population. We cannot vaccinate our children at this point because we do not have a vaccine for them. The only way to protect them is to protect them by immunizing yourself and having a cocoon around them that doesn't allow the vaccine, that doesn't allow the virus to reach them. So again, if yet another reason for which to accept this vaccine and to take them. So I'll stop there and turn it back over to the governor.
With that, we'll happy to take any questions.
Governor, you said on Sunday that you didn't expect a third wave of COVID cases in Arkansas. Well, some experts have said that they do. Why do you think we won't see a third wave, and are you using a different definition of third wave from some experts?
Yes, and I yield to the experts on that. But you know, when I said I didn't think we'd have a third wave, I don't think we will see what we saw and the extent of it last year, because we do have close to 50%, we have over 50% of our adult population vaccinated. So you're not going to see the deaths, as you've seen by the graph. You're not going to see the level of hospitalizations, in my hope. And so for that reason, I'm looking at hospitalizations, I'm looking at deaths. If we can succeed in getting more vaccinations out, we won't have the same level of a additional wave.
Governor, we just obviously went through the 4th of July weekend. Many families, friends getting together in large groups, watch fireworks, do whatever. What's your concern going into the next 2 weeks as we may see, these infections rise because of it?
Well, after Memorial holiday, after 2 weeks, we did see an increase in the cases, and so we sounded the alerts and said you've got to be more careful over the July 4th. And I actually, at least I was in Central Arkansas area, and I did observe a lot of people being careful out, having a lot of activities, but you know, the message is if you're not vaccinated, you still should wear a mask, and we did see some of that through the holiday time and social distancing. But the vaccination is a key. We've seen some uptick in it, so I'm concerned about what happens over the next 2 weeks, and it's all about individual responsibility and everybody taking the action that they should, and I'm hopeful that they've been responsible over the holiday and that we'll continue to be responsible in getting a vaccine.
Kind of getting into the younger population here. Are there any concerns? I mean, I know there's still about a month and a half or so till school begins, but have you sort of gotten the Department of Ed involved with, have some plans ready in case something needs to be done?
Well, that's exactly the reason that we're pushing as hard as we can through the summer so that we will have the highest vaccination rate possible before we start school next year. And so I'm taking it to the communities, I'm being there in person, encouraging that. But then secondly, we're going to have school this year and it's going to be very successful. You know, parents do raise the question, well, how about, you know, since the legislature passed a law, which I signed, that said the schools cannot mandate mask wearing in the schools, how about those that cannot be vaccinated? And I think Dr. Romero answered it perfectly. We need to build a cocoon around them. That means adults need to get vaccinated. Those that are eligible in terms of their age to get vaccinated. If all of those get vaccinated, we're not going to have any problem at all with the younger children because they are not as symptomatic. It doesn't impact them as well. And the worry is that they're going to spread it, but if others have the vaccine, it's not going to have that impact. And so we get our vaccination rate up, we'll be very ready for school.
Would you say the main goal of these community conversations is to address vaccine hesitancy, and how do you plan to convince people who aren't vaccinated at this point to take?
Well, the last thing they need to have is a governor coming and lecturing them, or even Dr. Romero, and so the intent is to have a conversation, and where they can talk to us. We expect to have community leaders there. We want to listen. I started to call this a listening session. And there might be some ways that we can enhance and improve our marketing, our advertising. What does it take to influence people? Maybe there's some questions that can be answered from a technical standpoint or a healthcare standpoint. Maybe there's some misinformation out there. And so we want to have an honest conversation. Obviously, my goal is to encourage vaccinations, but it starts with a conversation with the community. So we're going to see how it goes, and we hope that we have a good turnout and that people are honest and will express themselves, and we'll be listening.
Are you going to be targeting more rural communities in Arkansas with these community conversations? Because that's where we're seeing the lowest vaccination rate.
That's right. I want to go out from necessarily the population centers, and I want to go combination of some of the rural areas, but also some of the areas that have low vaccination rates. I hope to go down to Texarkana during this time and listen to them as well, and go up to Northeast. So I want to be out to the extent that I can in the communities that are more rural in nature, but also have low rates.
I mean, how much more encouragement do you think this will actually provide? Because, I mean, we've been beating this drum for a long time. Arkansas is 47th, 48th in the country when it comes to vaccinations. You know, kind of at what point do we just sort of accept it to a certain degree, or is this always going to be a constant battle that you guys are fighting?
Well, it does come down to individual responsibility. That's the message. But, I'm a leader of this state, and I want to do all I can. It'd be easier for me to sit back and say, I'm weary of this COVID conversation. I'm sure everybody in this room is, but that's not leadership. It is saying, let's plow on, let's get through this, let's see if we can do a little bit better. And so we talk about individual responsibility and try to encourage that and individual decision making. We have some online, I think, or remote.
Hello, yes, Governor, this is Mercedes McKay with Channel 11. I was just wondering, there was a summer camp in Searcy that actually had to send their campers home Saturday because of a COVID-19 outbreak. What's your reaction to that? I know a lot of campers were excited because they didn't have it last year. So what are your thoughts on that? And does that make you nervous for the rest of summer camp and leading into the school year?
Well, I hope that's the exception to the rule and that we have a lot of successful camps this summer. I know it's important for the young people and for parents alike. It's part of growing up in Arkansas. And so I hope we can have successful camps. But if once again, you can have a much more successful camp if those that are eligibly vaccinated are vaccinated, and hopefully with that they can have more successful camps. Do you all have any comment on that, or aware of that, Dr. Romero?
So exactly what the governor said, but also let me add to that we can screen these young campers before they go to camp, and we can offer screening during the camp. And so we can keep this under control if it becomes an issue. But again, the ability to test the children, the adolescents, before they go to camp exists. We, the health department, can place that at their disposal whenever they want it, and even testing during the camp period to prevent it.
Next question remotely.
Yes, good afternoon, Governor. It's Brett Rains with 4029 News. I'm curious, we saw, I believe if memory serves, approximately 99% nationally of COVID deaths were from people unvaccinated. Is that similar numbers that we're seeing here in Arkansas? I suppose this question is also for Dr. Romero. And we mentioned the partially vaccinated. Are we seeing those hospitalized as well? Could you give a little more information on that, please?
I'll let Dr. Romero answer. The answer is we're seeing the same numbers. It's 99% of those that are hospitalized have not been vaccinated. That's extraordinary. And so if you don't want to go to the hospital, get vaccinated. Now, in terms of if you only have one shot of a two-shot regime, then I'm going to let Dr. Romero answer the impact of that.
Thank you. Unfortunately, we don't have that data yet. And we're trying to mine that at this time. But if we go to the data that we know nationally, it's either one dose or no doses that are putting you in the hospital. We know for a fact that if you've only received one of the two doses, you're only got about 30 to 35% protection from the virus. So that's very, very important.
Any other questions?
What are some of the other big concerns that people have when it does come to hesitancy? Is it more access or, like you said, misinformation, conspiracy type stuff? I mean, what are some of those other reasons that we're not seeing people get the vaccine?
Well, on the side of young women, it's the myth that it's going to impact fertility. And so that's something that has to be addressed from a medical standpoint. I encourage everyone to make sure you get good medical information on that. You've got the myth that it's just they think about they got the flu shot, and so I took the flu shot but I still got the flu. Well, if you take the key fact, if you take the COVID vaccine, you're not going to be in the hospital. There's a 98% chance you're not going to be in the hospital, a 99% chance you're not going to die from it. Now, the odds are not that way if you get COVID and haven't been vaccinated, because you can see that from these statistics. And so, and I'm sure there's a multitude of other facts that are out there or myths that are out there. And, we want to rely upon data and information and accuracy, and the medical profession doesn't have all the answers, but we do see the data and the efficacy of this vaccine. And it is very important. This is the other thing that you hear, and I've addressed this multiple times nationally and with our director of the FDA, and that is that right now we're operating under an emergency use authorization for this vaccine. They say, well, you know, I'm going to wait until it gets the final approval. Well, you know, the FDA needs to act on that. They've got the data, not rush it. But once that final approval, hopefully that addresses some of the questions. But as some of the national experts have talked about recently, and Dr. Romero, there is an overwhelming volume of data right now that supports the efficacy of the vaccine. And so it is safe, it is effective, and that's the reason we feel comfortable in making sure that it's available. I cover that all right, Dr. Romero?
And I guess too, what's sort of the statewide status of the hospitals? I mean, obviously you're getting into that over 400, it kind of tends to put a strain on things. Are we starting to see some of that strain?
Well, there is, but when you look at our hospitalizations now, which is about 30% of what it was at the height of when we had over 1,000 hospitalized in early January. But the challenge is that everybody has put off so many different health needs that they are being inundated in the hospitals for other types of health care, and so they are crowded and they've got a full load that they're dealing with, but it's not all COVID. It is the multitude of health issues that Arkansans have. So that's a challenge, is making sure that that's coordinated well, and we'll continue to work with the hospitals on that. Thank you all very much.